My first name is Kyrollos.
Toronto pharmacist Carollos Massé barely has time for a quick interview.
Okay, tell him I'm going to call him. Sorry, there's a patient at the door.
He's overwhelmed with patients who want to avoid medical clinics and the ER, or want to see someone face-to-face in a time when some physicians are doing assessments over the phone or online.
Me personally having to do everything from bandaging up a patient that opened up his head and started bleeding and didn't want to go to emerge, or all the way to talking down someone from committing suicide.
He says he'd normally refer those cases to emergency rooms since pharmacists aren't typically trained to do those things, but he felt he had no choice and used the extra training he has to help.
And that's just me. My colleagues have plenty of stories.
Other pharmacies are losing staff to quarantine or fear and struggling to get the medications they need to fill prescriptions. And it's not just in big cities. Rural pharmacist Tamara Awada has faced difficulties before. Over the last few years, her community was hit by a tornado, flood, and now the pandemic. She's dealing with extra work and extra costs, like having to buy safety equipment.
But this is the reality. And we can get through this together.
These University of Waterloo students are trying to help. So far, they've collected 13,000 pairs of gloves and 400 face shields for pharmacists in their area.
We're here as pharmacy students fighting against COVID-19.
Some provinces, like Alberta and New Brunswick, have now ordered personal protective equipment for pharmacists and plan to distribute them in the coming days. That's what needs to happen across the country, says this academic.
So when it comes to planning for PPE or childcare services or COVID testing, in many cases, pharmacists are actually not included.
Still, many pharmacists say they're willing to take more on, and it looks like they'll need to. Some provinces, like Ontario and Newfoundland, are now easing regulations around renewing and transferring certain types of prescriptions without a doctor's approval to help ease the strain on the healthcare system. Rosa Marcatelli, CBC News, Calgary.